Good Day's House Call.
Well, car accidents can happen in an instant, and they can strike you and your family at any given time. But there are ways that you can avoid serious injury. Here with some information to help possibly save you and your family from harm. Dr. Jon Hyman, an orthopedic specialist right here in the metro area. Doctor, good morning. Pleasure to see you. All right, let's get right to it. Spinal and knee injuries are the most common, but obviously we talk about seatbelts, but they can be part of the process that injures you as well as protect you.
That's right. It's important to recognize that a proper fitting seatbelt is a significant factor in being safe in your vehicle. And, you know, some of us have large bellies or we might be small framed, and so the distance between us and the steering wheel can have a significant impact on whether or not the airbag has time to deploy and protect you, or whether you're too close to the steering wheel and actually can impact it, or your knees can hit the dashboard. So I wanted to make a point about seatbelts, if I might.
Okay.
So first of all, seatbelts, the front driver seatbelt should have an abdominal part or a horizontal part, which really is supposed to fit over the pelvis.
Okay.
If it's up too high on the belly and you lurch forward, it can cause intra-abdominal injury.
Okay.
And then there's also a part that goes over your left shoulder if you're a driver.
Okay.
And if it's too close to your neck and you're hit from the right, the seatbelt can actually cut into your neck or jerk your neck.
Oh, wow.
Or if it's too low on your shoulder, when you lurch forward, it can injure your shoulder. And the other important thing is that seatbelts, and this is actually not a seatbelt, but it's fairly thin. If the seatbelt's folded or it's too thin, it can actually cut into your skin and cause damage. So it's important to have a properly fitted seatbelt that's wide, not twisted, and not in some other way compromised.
Okay, let's talk a little bit about some of the knee injuries that you often see from car accidents.
That's right. So this is a knee model, and one of the things that can happen is when the knee moves forward and it's in a bent position, it can strike the dashboard if you're too close or if your seatbelt is not on, and that can cause significant trauma to the tissues around the knee joint. Sometimes even a knee that's twisted in an awkward way may become compromised. So knee injuries are fairly common. Also shoulder and elbow and hip, because if your knee hits the dashboard, then the force is transferred through your femur into the hip, and then holding onto the steering wheel, the wrists and the elbows. Yeah. And you know, if you're hit from behind and you're holding onto the wheel, when the car goes forward, if your hand's still on the wheel, your shoulder can get dislocated out of the socket. So it's important to be able to position yourself if you have time, which obviously we don't always have time to think about those things.
Absolutely. All right. Can I ask you real quick about the positioning of your headrest? Because I got hit from the back once, and my head was to the side of the headrest, and I always thought if my head had been up, or if the headrest had been up a little higher and directly behind me, it may not have the injury may not have been as bad to my neck.
That's absolutely right. Some older cars don't have headrests or headrests that are high enough, and it's absolutely important if you're in a seat that you have a headrest and your head be in front of it, because the impact can cause your neck to jerk one way or the other. And you know, if you're hit from the back, fortunately the back and the front have more protection than the side of the vehicle does, but the headrest is critical in protecting you from more severe injury.
All right, and of course if you have young children, you always want to get them in their protective car seats, and there's of course new legislation too for older kids getting into those car seats as well. So interesting information, good stuff for us. Thanks, Doc.
Thank you, I appreciate it.
What a pleasure.